All right, so as most of you know, I have an office over in Plantation. Let's see. All right, so I went to South Dakota State University. Go Jackrabbits. It's a very fierce animal, if you don't know. And then I graduated from Pennsylvania College of Optometry in Philadelphia, which is now part of Drexel, so the name changes over time, but when I graduated, it was PCO. And Philly's a great place if you haven't been there. So today I was just going to talk a little bit about some cases that I've had over the last maybe 6 months to a year, and just kind of what is the purpose of optometry. So everybody thinks that optometrists, you go and get your glasses, they renew your prescription, you get a new pair, and you go off for another, 1 to 5 years, and you go about your day. But it's a little bit more complex sometimes, and it's you're kind of like the gatekeeper. So the same way that like your PCP, like Dr. Vicioso, he's going to direct people on like where to go. Sometimes people will come for really nondescript complaints that can be very serious. And so, yes, we do glasses. So we do renew prescriptions, glasses, contact lenses, just the basic routine things. So this is a patient that I had. He was a very sweet old man. He was about 85 years old, and he had been trying to get his wife to go fishing for decades. She didn't want to go fishing. She finally caught a fish, and she reeled it in over her head, and the fish actually hit him in the eye. That was his lens implant from cataract surgery. He thought so that is the IOL that's supposed to be behind the iris, and it just popped forward a little bit. He was from out of town, traveling from Alabama. They're kind of snowbirds just here. So he just came to say, my eye, this is what happened. My eye hurts, it's red, my vision's a little blurry. So then I had to coordinate him with multiple specialists he needed referrals for his insurance because he had an HMO, so we had to get an emergency permission to do surgery in Florida. Seeing with the specialist. Side note, the wife doesn't drive their big RV that they're traveling with, so the husband is the only one. So trying to find somebody local, find out where they can go. This is actually like a multiple part surgery, so you're gonna need a corneal specialist, you're gonna need a retinal specialist. There's a really high chance of him developing glaucoma. So it's not just like, oh, we're just gonna go tuck that lens back in. It's a really complex case. But when people come, they don't know what to do or where to go. And so it's navigating something like this. All right, this is a visual field test of a patient. He had come in and just said his vision on one side was a little bit fuzzy, but he wasn't sure. He was young. He's only like 25 years old, I believe. So checked it initially. Everything looks good, but there was a couple little red flags. So the visual field is like a cheap MRI. The nose goes in the middle. You have left eye, right eye. The black is what he couldn't see. He had had a stroke, and he was very, very young. But again, no other symptoms. Had just noticed that his vision was a little bit blurry. He went to the emergency room. All right, so then this is kind of, we'll do a quick neuro lesson for anybody who's ever wanted one. So it's a great thing. So these are the eyes, and then the radiations there are the different pathways of the visual system. And you can have a tumor, a mass, a stroke, an infarction, whatever you want to call it, along any of those pathways. And based on the location is going to give you different visual field defects. So based on how something looks on that visual field test, we can locate within the brain where the problem happened. So, if it's just in one eye, it has to be in front of the optic chiasm, which is that X. And then if it's behind, depending. So we can determine if somebody had a stroke, this is going to be in the inferior occipital lobe. This is going to be in a superior occipital lobe. And based on the different locations, you can diagnose different things. And based on that can give how big of an emergency it is. So this is another patient. He was a very sweet old Cuban man. He'd actually lost vision in this eye years ago. He couldn't really explain why. He just knew that it was gone. And he came in because he couldn't see out of this eye now. So my apologies. This is left eye and right eye. This is left eye and right eye, so they're backwards. He was having a stroke in his other eye. So he'd already lost vision over here, and now he was freaking out because he couldn't see here. He got referred to Bascom Palmer emergency room because he didn't have insurance, and he was actually hospitalized for 4 days with IV steroids to try to get that inflammation and everything to go down. And he's starting to return vision like little by little. but it's not the greatest prognosis. This will actually happen if someone's having a side effect of GLP-1s. When they say that vision loss can be affected, it's actually like a microstroke within the optic nerve, and so it looks a little bit like that as well. Let's see. So other things that we do, cataract surgery management is a big part. When people need to go see the surgeon for cataract surgery, they're going to be given about 25 different lens options for the implants that are going to go inside of their eyes. The surgeons don't really go over it very much, and then they go sit with a salesperson and they sign up with what they're going to either covered by insurance, what they're going to pay for, and they don't always understand the outcome of that. So I have the time to sit with them and go over like their expectations, like these are your choices, these are your options, this is what might be better for you. And so they have a better, more realistic expectation of what's going to happen after cataract surgery. A good example, someone who's nearsighted and they're 70 years old, takes their glasses off to read, and all of a sudden they go have cataract surgery and they're given distance implants and they can't read up close anymore, and they are not happy. But they were told they're going to fix their distance vision, but it was never explained to them that they're going to lose their reading vision. So it's just being able to have those conversations is really important. Diabetes care is basically just checking diabetics annually, sometimes a little bit more, making sure there's no retinopathy in the eyes, no bleeding in the eyes. Glaucoma is a really, it's an easy disease to manage as long as people are compliant. And so it's a good thing to kind of follow up with, see people regularly, get them in on time. Vision loss with glaucoma can be devastating, but as long as people are compliant, they follow their appointments, they follow their things, it's really, really easy to manage. And then the other one is just ocular side effects of systemic medications. There's a lot of different autoinflammatory medications, cardiac medications that have different side effects within the eyes. So being able to just see those patients regularly gives a better idea of if it's having any effect on them. All right, and so then one of the other things that we do is we work with pediatric patients. So this is a test called a readalizer, and it analyzes their eye movements. So that's normal. Your right eye and your left eye are supposed to just be in sync with each other and follow along the page. And so that's reading across and then be able to go back to the next page and start over on the next line and then read across and back. Some children have difficulty with that. Their eyes don't move at the same page. They're kind of in different paces, they're in different spots, and so their reading becomes really inefficient. They'll start to have issues with fluency, with comprehension. They'll get behind in grades, things like that. And so we can do different things to kind of help them stay on track. So, all right, I have some things. So one of the things we do, which doesn't necessarily, so whenever we're doing like a therapy patient, we always have a metronome in the back because you want to have them get in this pattern of everything just being a very smooth thing. And so having a beat really, really helps with that. So that goes. All right, so I can pass this around. This is a rock card. This is something we do a lot of. And we go with the metronome and we flip the lens in front of the eye. And they read the first word, the second word. And each time they flip and flip and flip. And they go with the beat. And so it helps getting them to read in a pattern. And it helps get their eyes to focus and unfocus. And so it really helps with that. Then this one is also a lot of fun. This is a Marsden ball. This hangs from the ceiling. And so what we do with them, let's turn this up a little bit. It's really loud. There we go. All right, so what we do with this, it hangs from the ceiling, and we get a good judge, and then, okay, read the letter as it comes to you.
Oh, God.
They keep changing. There you go.
E.
Well, no, you can do a new letter.
Oh, okay. T. O.
So that's one of them. The other thing is, okay, we'll do one. You're going to hit it with your hand. Okay, now left.
Strike one.
Left. Right. Left. So it's working with lefts and rights and laterality. Then the other thing, we're gonna change the thing. The hand is really easy, but now hit it just with your thumb. Left. Left. Right. Right. Okay, now read a letter to me while you're hitting it, alternating with your thumb. It is. Alternating, okay. Yep.
N. Z.
So it's getting the child to be able to incorporate all of these different parts of the visual system together. When we're doing that, they're generally standing up. We also have a balance board, so when we get more advanced, we work on our balance as well as our visual system and integrating that all together. And it really makes a difference for a lot of children over time. Thank you, Robert. All right, what? I didn't. I put him on the spot. So one of the other things that we work with is concussion patients. Concussions are really devastating to people. They have a lot of visual system issues afterwards. And so we do a lot with tints. It's not really known exactly why, but there's a lot of light sensitivity after concussions, and tints will make them feel better. So we have the concussed patient come in, and they try different tints. And they can analyze different colors, different things, and then they will just feel better over time as they wear them. And they pick out the tint they like the best. This one's really nice because you can get the tint made as a clip, so you can actually match their current glasses and then get the tint made, and then it just clips onto their current frames. Look at those if you want to. And so what you're doing is you're allowing somebody who is healing from a concussion, and you're allowing them to get back to their life faster. If they can't sit with fluorescent lights or they can't sit through a school day, there's things like that, especially with motion. Their brain can't handle the motion on top of the visual system, on top of the lights. It's just very overwhelming. And so what the tints do is they calm the system down, and they allow them to get back to being able to work a full day or go to school for primarily school because they're usually younger, and be able to kind of get back to day-to-day things a little bit easier. So that's just kind of an overview of what I do on a day-to-day basis. It's a little bit of everything. So we do glasses, we do contacts, we do concussions, we do children, and that's just a general day in primary care optometry. Does anybody have any questions, curiosities?